So today's webinar presentation addresses Pennsylvania's early childhood health and safety system supports. During today's presentation, we will cover the basic information needed to support those who are providing childcare during COVID-19. So welcome on behalf of the Office of Child Development and Early Learning, OCDEL, in collaboration with the Pennsylvania Key. This webinar is the first in a series of 5 webinars being offered to system support teams. Today's topic is the CDC Guidance for Childcare. While we are focusing on childcare, these principles are relevant to all early childhood education provider types. Today's live webinar is a presentation-only format, and all participants are muted. Tomorrow, we will follow with a 90-minute open space session for interactive questions, reflections, and sharing. Webinar recordings will be posted with slides on the PAKey website at the link on the slide. Questions may be submitted anytime to this email address, hssco@pakeys.org. Just a few housekeeping points. All participants are muted, and we ask that you please turn off your video to avoid distractions. Participants may type questions into the chat box. However, questions will not be addressed during today's live webinar. Each live webinar is followed the next day by a 90-minute open space session. Questions that are typed into the chat box will be addressed during the open space session tomorrow. So hello everyone, my name is Amy Requa. I am a pediatric nurse practitioner and the senior health manager at the Pennsylvania Key. And along with me is my co-facilitator, Laura Johns, managing partner of Propulsion Squared. Also, Laura will be joining us tomorrow as well to support important conversations around implementation across all program types. So the goals for today's webinar are to provide support teams with information and resources to support providers in Pennsylvania, to protect the health and safety of children, staff, parents, and support teams. And while we are focusing on childcare, these principles are relevant to all early childhood education provider types. This is a list of the early childhood health and safety system support teams. All of these various system support teams are involved in this unprecedented effort because OCDEL recognizes the importance of consistent understanding and the ability to be responsive to all providers in Pennsylvania. So welcome to everyone for joining. Our content today follows the Centers for Disease Control, or CDC Guidance for childcare programs that remain open, which was published on April 21st of 2020. A special note about the guidance also, in addition to CDC guidance, more state-focused guidance is provided through the Pennsylvania Departments of Health and Human Services and OCDEL. Also, OCDEL is being advised by public health experts from the Children's Hospital of Philadelphia, better known as CHOP, and a group of pediatricians and members of the PA chapter of the American Academy of Pediatrics, and health experts experienced in childcare health consultation and technical assistance. So let's take a look at the OCDEL guidance. Today's training is about getting the basic information to you. This content is very detailed, and you will have it as a foundation for your work in supporting providers going forward. We will be covering these topics today, which are outlined in OCDEL's announcement C-20-06, which was revised and published on July 8th, 2020. Our goal is for you as support teams to be able to serve as a resource for reopening childcare and to continue to support providers who are currently open. and tomorrow may be the better day for processing when we have our open session discussion and opportunity for questions, reflection, and sharing of ideas. First, we want to point you to 3 essential resources. These include the CDC's April 21st, 2020 supplemental guidance for childcare programs that remain open. Also, the American Academy of Pediatrics guidance related to childcare during COVID-19 and Caring for Our Children, 4th edition. Today, we are looking closely at basic information, and tomorrow may be the better day for processing during our open session for question, reflection, and sharing of ideas. But let's start by reviewing what we currently know about COVID-19. Since the coronavirus is new, we don't know much about it yet, but our understanding about it improves on a daily basis, and our knowledge can change quickly. Some people have mild cases, but it's clear now that people of any age with underlying health conditions are at risk for getting sicker. We know that children and adults with underlying health conditions or special healthcare needs require extra precautions. From early on, we learned that older adults are at higher risk. Based on data collected by the CDC, we now know that pregnant women need extra precautions. And we're more informed now about how some people with developmental or behavioral disorders may have difficulties accessing information, understanding or practicing preventative measures, and communicating their own symptoms of illness. So this is very important to be able to understand that there are a variety of groups who do need extra precautions and to be aware of this. Based on the available evidence from the CDC that we have so far, as of July 3rd, 2020, children do not appear to be at higher risk for COVID-19 than adults. While some children and infants have been sick with COVID-19, adults make up most of the known cases to date. Here are some take-home messages. Children get infected less, have milder cases, and spread COVID-19 less than older individuals. This should be reassuring for the group childcare setting. Though not as safe as staying at home, the childcare setting is not the worst place to be. Children are much more likely to get infected, in fact, from adults. And when children are infected, they spread disease at very low rates to other children. Asymptomatic spreaders are more frequently adults. And in general, children are not the super spreaders of COVID-19, unlike other viruses such as flu and measles. The CDC data as of mid-June show that there is a long-standing systemic health and social inequity, and we have seen this in terms of some members of racial and ethnic minority groups that are increased risk of getting COVID-19 or experiencing severe illness, regardless of age. Black and Latino people have been disproportionately affected by the coronavirus in a widespread manner that spans the country throughout hundreds of counties in urban, suburban, and rural areas and across all age groups. The conditions in which people live, learn, work, and play contribute to their health. These conditions, referred to as the social determinants of health, over time lead to different levels of health risks, needs, and outcomes among some people in certain racial and ethnic minority groups. Experts point to circumstances that have made Black and Latino people more likely than white people to be exposed to the virus. So it's important to be aware of this. Among some racial and ethnic minority groups, including non-Hispanic Black persons, Hispanics and Latinos and American Indians and Alaska Natives, evidence points to higher rates of hospitalization or death from COVID-19 than among non-Hispanic white persons. And as of June 12, 2020, age-adjusted hospitalization rates are highest among American Indian or Alaska Native and Black people, followed by Latino people. In fact, American Indian or Alaska Native people have a rate approximately 5 times that of white people. Black people have a rate approximately 5 times that of white people, and Latino people have a rate approximately 4 times that of white people. And you can access this information in greater detail at the link that I've provided. So let's think about COVID-19 a little bit and how it spread. There are some things that we do know now better than we did before. COVID-19 is mostly spread by respiratory droplets released into the air when people talk, laugh, cough, or sneeze, primarily through face-to-face interactions with those people who are outside one's own household. So folks outside of our households. It is thought that the virus may spread to hands from contaminated surfaces and then to the nose or mouth or eyes, causing infection. In fact, the only way we can get infected with the coronavirus is through our nose, our mouth, or our eyes. And indoor spaces are more risky than outdoor spaces, as it might be harder to keep people apart and there is less ventilation. Signs and symptoms of COVID-19 are highly variable from one person to another. We've learned this. Here's the current list. More signs and symptoms may be added in the future, or they may change again soon as we learn more. A person who is infectious may not show any of these signs or symptoms. That is called being asymptomatic. And this is what is really making it very difficult to know who is infectious. The emphasis, of course, from the very beginning has been on physical distancing of at least 6 feet between people. And I remember listening to a presentation by Sanjay Gupta when he said it might be helpful to have a visual aid for this, like thinking about the length of a pool noodle, for example, as a visual aid of what 6 feet looks like. We want to make sure that we're maintaining our social engagement, even though we're having physical distancing. That's very important for our early learning settings. So let's talk a little bit now about planning. This is the new CDC childcare decision tree, and it's actually part of a 60-page CDC guidance publication, which provides additional roadmaps for the community. It's in the news, it has been, and it can be used to assist directors and administrators in making opening and reopening decisions regarding childcare programs during the COVID-19 pandemic. It actually covers 3 phases. The first phase is scaling up operations. Second phase is health and safety recommendations. And the third phase, of course, is ongoing monitoring and keeping everyone safe and protected. Now let's think about how to frame program implementation and practices. Of course, the expectation is that programs will follow state licensing regulations. Recommendations need to be considered, of course, when developing plans for implementation. And it is important to emphasize that OCDEL is being very responsive in providing updates, which reflect the increased and changing communications that come along with a changing landscape and direction from federal and state experts during this time. Here's a list of early childhood education best practices with corresponding caring for our children standards, which are listed there in numbers. So be sure to check these out. You can do a Google search on caring for our children, and it should take you to the web page where you can access these standards. So what practices are different now that we're in the pandemic? You can see on the left-hand side there of the chart, there's a list of best practices around all these different areas of the program and different things that need to be addressed. And then there are the new practices on the right side. So there are some really significant changes. As we go through this, you'll begin to see that, for example, with food preparation and nutrition, in many programs in the past, they've been serving congregate meals or family style meals. But now we've been asked and guided to serve children individually to prevent the transmission of the coronavirus. So things really have changed. When you think about physical activity, it's even more important now to be considering how to plan for outdoor time and new activities which engage children outside, because that puts them at less risk for transmission of the virus. This is just one example of specific guidance from the CDC, which addresses the drop-off and pick-up protocols for childcare settings. It's important to stagger, if we can, arrival and drop-off times. Sometimes that's not possible. It depends on the size of the program and where it's located. We can plan arrival and drop-off outside the facility. Some programs are doing curbside, for example. Of course, providing hand sanitizers, limiting direct contact, and designating a parent or person who is not a vulnerable person to pick up the child or drop off the child every day, and to avoid having direct contact between individuals. So OCDEL's interim guidance here from C-20-06, which, as I said, was revised on July 8th of this month. It mirrors in great detail the CDC guidance for drop-off and arrival procedures. And Laura, if you're there, you feel free to provide some comments about this if you'd like.
Sure, Amy. Yeah, I think the most important thing I would say is that we really want to think about the drop-off and arrival procedures from the standpoint of the type of provider. A family child care provider is going to approach drop-off and arrival procedures very differently than a center-based provider. And drop-off for an infant or a brand new walker is going to look very different than from a school ager. So for family child care providers, especially if it's one provider, one human being in the home, I really would make sure that anyone providing that person with technical assistance directs them back to their certification rep to really make sure that they're not only meeting the guidance from the CDC and from OCDEL, but also staying very closely in line with their licensing, their certification regulations. So it's very important that those considerations of if I'm by myself, which means I can't go and pick up a child outside and do the screening procedures outside and then come in and be with my other children, that's not going to work. So to make sure that they're really working hand in hand with that certification rep to vet their process and to vet their health and safety procedures.
Thank you so much, Laura. I just want to point out a few of the items here that are listed. It's important to post signage for parents and families about what your process is and what your procedures are so that they can see it, and to communicate with them regularly. Also, as I mentioned before, individuals with serious underlying medical conditions really should not be designated to pick up or drop off children. And if a sink with soap and water is not available, it's important to provide hand sanitizer with at least 60% alcohol available next to the parent sign-in sheets, and to keep the hand sanitizer out of children's reach and to supervise the use of the hand sanitizer. We have been told that it is okay to use hand sanitizer on young children in the program, even children under the age of 2, as long as the caregiver or the teacher is pushing the hand sanitizer by themselves into the child's palm and then making sure that it gets fully evaporated. That would be a safe way to do it. Also, it's important to consider greeting children outside as they arrive so that they are comfortable and feel safe, and to designate a staff person to be the drop-off or pickup volunteer who will walk children to their classrooms. And at the end of the day, to walk all children back to the entrance or to their cars, for example, depending upon the method that the program is using. We want to avoid having visitors in the program because that increases the risk of transmission. Just to emphasize, it's important to communicate with families. Updating emergency contact information is essential. We need to always be informing our families about policies during the pandemic emergency response, because we know that that includes updating them on any changes, any increases in procedures or things that they might not be accustomed to. And it's not that we're flip-flopping on these guidances or practices, it's that we are being responsive to the changing landscape and direction from federal and state experts. So that's important to communicate to families, that we're trying to stay really up to date with the most current guidance. Also, it's important to check in with our families about their well-being during this time. There's a lot going on, as we know, and that concern and compassion for families really goes a long way in building a good relationship. So a very important aspect, of course, in all early learning programs to keep everyone safe and healthy is to do the daily health check. This is something that's been a part of the life of every child care provider for a very long time. So it now includes, of course, the temperature taking. And we do not want to admit children or staff, for that matter, with a temperature equal to or greater than 100.4 degrees Fahrenheit. And if there are concerns around cough or trouble breathing, those are some of the symptoms, right, of the COVID-19. So it's important that before people even come into the facility that we're doing a daily health check and we're asking those screening questions and we're doing our temperature. That's really important. So when we're looking at the CDC guidance, they provide very specific methods here. And I'm not going to go into all of them. I'm not going to talk about all of them, but I want you to be aware that there are 3 screening methods that have been provided in the literature that has been published by CDC. And there are very detailed instructions outlined in the document. And so we recommend that you take a look at that. The take-home message on all of this is, as Laura was saying earlier, one size does not fit all. So the choice on screening methods is going to depend on many factors. It'll depend on the setting, what type of program it is, the staffing, what kind of capacity the program has for managing these different methods, and of course where the program is located. If they're on a busy street or if they're in a rural area, all of these things need to be taken into consideration by the program when they're thinking about their screening methods. And of course, it's a work in progress. It's a process. So they may try some of these methods and decide that they need to go in another direction. And that's very normal. That's expected. And that is what we have seen with programs who have been operating under a waiver since March. So there's going to be a lot of variety in how programs address the screening process. This is just a slide that talks about the different types of thermometers. There are lots of them out there now, and the most important thing to remember, of course, is that fever is equal to or greater than 100.4 degrees Fahrenheit. Some of the considerations around asking families to report daily temperatures, if this is one of the screening methods of the three that has been chosen by a program, they need to be thinking about whether their families have access to a thermometer. I think some of the research has shown that less than 50% of families actually have a thermometer in the home. Also, do they know how to appropriately use and read the thermometer? Because they're all very different and it can be confusing. So these are aspects of education and guidance that programs can provide to families around reporting daily temperatures. And many of the programs that I've worked with have decided that they really don't want to rely on families to report these daily temperatures. So they've decided to go with methods for screening that require the program, a designated person, to be doing the temperature checks of staff and children before they even enter the facility. So let's go now into some of the programmatic topics to go into greater detail about what this looks like in the program. I thought it was important to talk about masks because it's a very hot topic, and I didn't want to leave it to the end because I figured someone might be waiting to hear about it, and that would be distracting. So we're going to talk about it first. And we're going to review several important highlights of OCDEL's current interim guidance for the certified child care facilities operating during the pandemic, which was published on July 8th. So this is the information that has been provided around face masks in the revised interim guidance. And we want you to have the basic information about this, and I'm not going to read the slide to you because I know you know how to read. So, but these are the requirements on face masks, and it's important that you be fully aware of what's in that guidance if you want to provide support, and we're expecting you to do that. So we hope that you will take some time to go through this guidance yourself and think about it, and think about how this order of the Secretary of the Pennsylvania Department of Health requiring universal face coverings and the paragraph from the Pennsylvania Department of Health, which is provided here on the slide, really impact the programs. And as I said earlier, there will be opportunities throughout the training series to talk about implementation considerations for face masks. And for example, plastic face shields are included in the allowable coverings. This is information that just came out recently, which is new. And Laura, of course, is available to help facilitate ideas to support staff, parents, and children with mask wearing. So Laura, if there's anything you want to add right now, feel free.
Sure, and I think we can further discuss this tomorrow, but I think there's a lot of issues around that. Number one, that proper face covering size and fit for all children and who's providing that. And so as you're providing technical assistance and coaching to providers, both center-based providers and family child care providers, really helping them think through whether or not the families are bringing face masks or whether they're going to supply face masks. If it's a cloth face mask, how is that being washed? How are we making sure that children don't decide that they're going to swap face masks, which I think a lot of like 3-year-olds would love to try on each other's face masks, as you all can imagine. So really thinking through all of those kind of nuances about how children will experience face masks is really important. You also want to help providers think about how to normalize face masks, possibly doing some FaceTime with families while they're wearing their face masks, having face masks available for the dolls and the puppies and all the stuffed animals in the program, thinking about how families can practice having their children wearing face masks at their own homes, maybe on the drive to the child care program. So again, how do we help providers support the normalization of this particular practice, I think is going to be really important.
Thank you. That's great. Here is the information around physical distancing, and it really mirrors pretty closely the CDC guidance that was published on April 21st. So in general, we're wanting to encourage providers to keep group sizes small and manageable. And because again, as the numbers go up in a congregate setting or a group care setting, it's going to increase the risk for transmission of the coronavirus. It's just one of the aspects that we need to be aware of. In general, children and staff are encouraged not to change groups or to mix groups. So in other words, creating a separate classroom or group for the children of healthcare workers or other first responders is encouraged. And to consider, you know, as far as keeping each group of children in a separate room, then staggering, for example, meal times if they have to go to a particular area of the program. Many programs are doing meals in the classroom, so the kids don't need to move into different areas, and that is recommended. So limiting the mixing of children, staggering playground times, and keeping groups separate is really important. There has been some guidance around keeping siblings together if possible, and also at nap time to ensure that the children's nap time mats or cribs are spaced out as much as possible, ideally 6 feet apart. Sometimes this is very difficult to manage, so another option would be to consider placing children head to toe in order to further reduce the potential for the spread of the virus. So again, it's going to really be a consideration that needs to be taken locally by the individual child care provider about how to manage these spaces and to consider how to stagger activities. One of the main points also is to provide individual materials, a set of materials for children so they don't have to share. So that's really important as well. That's part of the consideration. We're going to talk more about this tomorrow, obviously, when we have our interactive time together to think about strategies and ideas that have already been implemented by child care providers very successfully, even thus far after being open for several months. That we have some knowledge out there that's worked, and we have some strategies that are working for people. So we will be sharing that as well. A lot of questions always come up around the physical distancing for infants and toddlers. And, you know, with this group, it's very difficult to follow the physical distancing guidance, obviously, because they rely on us and being close to us and being held, and we feed them and we comfort them. So it's not possible to care for infants or toddlers from a distance. And in that case, we need to make some adjustments to keep everyone safe. And part of that would be including clean smocks for staff and changes of children's clothing. And this is done so that we can avoid being soiled with secretions or body fluids. So staff should wear smocks, and another option is to wear oversized shirts. And to protect themselves from the secretions, they should be wearing, you know, masks. They should have their hair up if possible to avoid soiling their hair. And if there are secretions that they get on their skin, of course, they can use an alcohol wipe to wipe that off, and they just have to be very flexible and attuned to, you know, the needs of the children in their program. They also need to have several backups on hand, so multiple backups of clean smocks and oversized shirts will be very helpful. And also children need their clothing changes on hand as well. And when we talk about clothing available in the program, it's always a better idea to provide laundry facilities within the program for laundering these smocks and oversized shirts, for example, for the staff. It's better to avoid transferring any clothing or any supplies or materials, for that matter, back and forth from home into the program. Because if we can cut down on that, we can cut down on the transmission of the virus. Some of the physical distancing strategies, which we'd like to share with you, and they include some very basic, simple things, which are to arrange the furniture in the classrooms to give children more space, arranging furniture in the family childcare home may be a little bit more difficult, but it's due to limited space, of course, so that will vary greatly. Also, opening windows for fresh air. The ventilation is very helpful, and as I said earlier, having lots of outdoor activities is going to be really helpful to keep kids outdoors and in the air where there is more ventilation, because we know that the transmission of the virus increases if we're in confined spaces. And if that means if we're in indoor spaces, especially with people outside our own households, it increases the risk for transmission. Also, placing cots and cribs a good distance apart, as I mentioned earlier, that's also a good option. And Laura, would you like to add some thoughts?
Yeah, just one big thought that I imagine every certification rep on the phone is thinking about in relation to these open windows. We do, again, want to remind our early care and education providers regarding the regulations around open windows. And open windows are great, but they have to have screens if we're opening them. So we really want to refer people back to their regs and make sure they have screens that are in really good repair if they're opening their windows. And of course, although I don't know if we have any providers who operate on multiple floors of buildings, that might not be the case. But of course, if there is a window that's higher up, we want to make sure that window is only open no greater than around 6 inches, I believe the certification regulation states, and that it's secured at that 6 inches so the children can't push it up. But again, those screens are really important, and they have to be in really good repair. So we want to remind programs about that particular system.
Thanks, Laura. Another aspect of limiting transmission is to reduce the clutter and to eliminate shared toys. As I said earlier, any way that we can limit the sharing of items, including art items or materials or supplies, toys, of course. We want to keep surfaces clear so that you can clean and disinfect them easily. So one of the first things that we've seen with providers is to simply reduce the clutter. Get only, the things that you're going to be using, leave those in the classrooms, and then basically store everything else. Because if you're not using it, it should be out of the room. And otherwise, people can touch it and then transmit the virus through surfaces. So also providing as much open space as possible. This means, for example, moving things around in the classroom. Classrooms are going to look very different. Some of those areas in the classroom where kids were allowed to huddle together to do activities are going to be looking different now. We're not doing circle time in the sense that we're sitting closely together. We're going to be staggering some of those activities so that you are doing more one-on-one types of things and still maintaining the physical distancing between the staff and the children. Of course, you're still going to be doing the reading and activities, art activities, and the things that children love to do, but you have to think about it differently. And what I've heard from providers is that they've posed some of these problems and challenges to their children that are in the program, and the children have actually come up with strategies and ideas that work for them. And then when they have buy-in and they're a part of the solution, they feel very proud about that. And so that seems to have worked well with a lot of programs. Again, discouraging items coming from home, a very important point. And limiting the sharing of toys to items that can be cleaned and disinfected easily is really important as well. Just to highlight some of the resources that are available to make things a little bit more fun for the early learning setting is some of the Sesame Street material. It's really been well designed and is very accessible and helps people to understand how to deal with some of the feelings that they're having these days. And it works great for kids, but it's also good for adults, I think, to be looking at the Sesame Street materials and thinking about how to give ourselves one of those virtual hugs or even a self-hug with Abby Kadabi. I think the Sesame Street materials are really helpful when conveying messages to families in a way that's accessible and easy to understand. So be sure that you're looking for these types of things. And this is just one example of something that's out there that we encourage you to access for your families and to share that information with providers so that they can share it with families. Hand hygiene, we've heard a lot about this, right? Most of the programs that we work with are already doing these things, right? Or they should be. A visual aid that shows the key steps to hand washing is really helpful, you know, because there are several steps, 5 of them listed here, very important aspects. And of course, doing the scrubbing of your hands for at least 20 seconds, using a timer, singing a song, the alphabet, happy birthday, lots of different things like that. I'm sure that many child care providers have great strategies for this already, but just encouraging and reinforcing the hand hygiene is really important. And using visual aids like posters and having things by the sink, of course, is really helpful, not just for children and, you know, parents, but also for staff to be following these procedures and practices. And of course, to have policies in place. That's a key part of it too, that parents are really informed about your policies and program policies around all of these things that need to be followed in the program. That's a big part of our communication responsibility with families, is to have them understand why these things are so important right now. And hopefully some of these great strategies will be also transferred to home as well. And when children are doing these types of healthy activities and promotional activities in the classroom or in the family child care home, they're more likely to go home and reinforce those things with their families, with their parents, and they get a lot of pride out of being able to do that. So it's really helpful for everyone involved to have these hand hygiene posters and to reinforce those practices. What about cleaning and disinfecting? A lot of emphasis has been put on the cleaning and disinfecting, and there are different definitions, of course, for these things. To clean means to physically remove dirt, debris, and sticky film by washing, wiping, and rinsing. Before we disinfect anything, we have to clean it first, because we have to remove that dirt and debris and anything that has soiled whatever it is, whatever that surface is. We need to do that first. And So that goes first before we disinfect. And to disinfect means to kill nearly all of the germs on a hard, non-porous surface. We do have some guidance for surfaces that are porous. I didn't cover them in this presentation, but we will probably be posting additional resources for you. For example, we've gotten a lot of questions around how do we disinfect wood blocks or those mats that infants are on during the day in a child care program, those foam mats and things like that. So there are different procedures for those things. One of the resources that we want to point you to is Caring for Our Children, Schedule K, and the link is right there for you. I recommend that you take a look at that and to think about how to share that with your programs and to work through some of these procedures together. So what surfaces should be disinfected? Well, there's some obvious ones, right? And it's very detailed information that I'm sharing right now. So you're going to need to think about this, but of course, drinking fountains, very important, door and cabinet handles, anything that's high touch, that is frequently touched throughout the day, surfaces that have been soiled with body fluids, for example, in toileting and diapering areas, when you have diaper changing tables and diaper pails, countertops in bathrooms, potty chairs, hand washing sinks and faucets, toilets, and bathroom floors. The mouthed objects in particular need to be collected. And many programs that I've heard from have designated one person to go from room to room and to be on top of that in terms of taking the mouthed objects and toys and putting them into a tub which is secure and out of reach, that is designated as something that needs to be cleaned and disinfected. And if at all possible, when a child mouths an object or a toy and they've discarded it, it needs to be picked up as soon as possible and put into a tub and kept out of use until it's been cleaned and sanitized and disinfected. So this is really important information to be sharing with the providers, and many of them are probably doing these things just sort of by nature and by habit. But we want to reinforce that we're intensifying these aspects of cleaning and disinfection during the coronavirus pandemic. What surfaces should be cleaned? Well, of course, the toys, the bedding, the floors, the clothing, including hats, cribs, cots, and mats, play equipment, and that includes outdoor equipment. Although we don't have to be quite as intense, I don't think, about the outdoor equipment, it is a good idea to at least wipe it down and spray it with a disinfectant once a day. Some programs are doing it more frequently if they have groups of children that are coming in and they are able to, they have staff and the ability and the capacity to do it. Of course, we recommend that they would do it between the groups, using the playground structures and so forth. Also refrigerators, of course, that's a frequent touch appliance in the program and needs to be intensified cleaning. Always clean before applying a disinfectant, as I said earlier. This is something really important. Bleach, of course, has been around for a long time, but it's important to use an EPA registered disinfectant. And I've provided the link here to the list of the EPA registered disinfectants. And the list changes frequently. So it's important to access that on a regular basis and to give people the tools they need to access it. Going through all of this in a very methodical way is important. You want to make sure that there's someone designated to mix the solutions daily and to follow directions on the label for disinfecting. And it should be updated regularly based on what product you're using. Follow the manufacturer's instructions, of course, on the label for disinfecting. And it's always possible to give a call because they usually list a number, an 800 number on their label where you can call and ask for more specific guidance. You should be labeling the bottle with the date and with the product, the name of the product, wearing gloves and protective eyewear when diluting, using a funnel, mixing it in a well-ventilated area. A lot of programs make up these solutions after the children and staff have left the program, and to be sure to do it in a safe manner is really important. So you want to be protecting your staff. Always use caution with disinfectants. Again, providing ventilation, holding the bottle at a safe distance when spraying, labeling the spray bottle dilution with a product and date, keeping products out of children's reach and in a locked cabinet, wearing personal protective equipment such as gloves and eyewear, and disinfecting when children are not in the area. Although throughout the day, it is recommended to, of course, intensify the cleaning and disinfection of those high frequently touched areas, like the doorknobs and the surfaces and the refrigerator and things like that. And of course, in the toileting areas and places. So if that is kept up throughout the day, then you're going to be that much further ahead. The surface should be dry by the time the children return to the area. A lot of these solutions are very specific with how much time they need to be applied and allowed to sit on the surface wet until they dry for them to be effective against the coronavirus. So that's important information. And do not mix products or reuse bottles for different products. And I make a joke about this, but it's true. We're not in chemistry class. So we don't want to do any mixing of these products. It's definitely not recommended. It can create a toxic solution, and that would be very dangerous. So the OCDEL interim guidance does cover a lot of these procedures, which is very helpful. And it goes into great detail about that, again, mirroring a lot of the CDC guidance. But it's important, again, to post the procedures in highly visible locations, such as facility doors, lobbies, restrooms, and also to promote the everyday protective measures for staff and children. And these frequent reminders and visual aids, they do go a long way. So having visual aids is really recommended for programs. For example, like when we go into the grocery store, right? We see that some aisles have been designated one way for traffic to go one way. A lot of childcare providers have done that in their settings to keep people from crossing each other and being close to each other when they're crossing in the hallway. So those are examples of visual aids that are very helpful for people to follow. Again, just intensifying the cleaning and disinfection efforts. Developing a schedule for cleaning and disinfecting is really important. So as a support person, support team, that's going to probably be one of the things that you want to make sure you're assisting with. And again, the routine of doing that and how to do it in a way that is basically becomes a habit for people is really important. And the emphasis is on intensifying the cleaning and disinfection practices throughout the day. And routinely cleaning and sanitizing and disinfecting surfaces and objects that are frequently touched. And a lot of this guidance really follows very closely the CDC guidance for childcare programs that remain open. That was published on April 21st. A lot of information here from the OCDEL interim guidance around cleaning and sanitizing toys. Again, toys that can't be cleaned and sanitized should not be used. They should be stored. And toys that children have placed in their mouths or are otherwise contaminated by body secretions should be set aside until they're cleaned by hand by a person wearing gloves. And there's a very specific guidance here about how to go about doing that. And I think probably a lot of the child care programs and operators are doing this already. But to just clarify, it's important to clean first, right? With the water and detergent, soapy water, rinse thoroughly, and then sanitize with an EPA registered disinfectant. Rinse thoroughly again with clean, fresh water, and then allowed to air dry. This is the process. And it's also possible to clean with a mechanical dishwasher. Machine washable cloth toys can only be used by one individual at a time or should not be used at all. And it's usually not something that we want parents to bring from home. It's one of those things we would ask them not to bring, would be those types of personal objects, stuffed animals and things that kids bring from home should be avoided. And they can be laundered, of course, at the facility, and that is recommended, rather than transferring these toys or personal items back and forth from home. It's better if the operator launders them on site. Making sure, again, that toys are set aside that need to be cleaned. And as I said, a lot of the child care providers have designated one person. They found that that was very effective, and it was cost effective for them to designate one person to go around throughout the day and pick up those toys to be cleaned. And this actually saved time and allowed the teachers to be more focused on the education programming rather than always, having to deal with the cleaning and sanitation and disinfection. So that's just one example of how programs have adapted to these intensified procedures. Again, the emphasis is on using bedding that can be washed and to keep each child's bedding separate, and to consider storing them in individually labeled bins, cubbies, or bags. Many of the programs that I've spoken with are using bags, but they've kept them in a safe place so the kids aren't, getting into them. Those are considerations that need to be made. Cots and mats should be labeled for each child, and bedding that touches a child's skin should be cleaned weekly or before use by another child. So that pretty much goes without saying, but it should be part of the cleaning schedule to include the bedding. When possible, bedding should be laundered by the facility, as I said before, to reduce the back and forth transportation between the child's home and the facility. This will cut down on the transmission of the coronavirus. Food preparation and mealtime has changed quite a bit. Most of the programs are already practicing some of these health measures, but again, some of them really have significantly changed, and that is we need to avoid the family style meals, the congregate meals, any sharing of utensils, or any items that have been used for family style meals in the past. Those things should not be used. A lot of programs have gone to paper products to avoid the sharing of utensils or having to deal with the cleaning and sanitation and disinfecting of those utensils. So a lot of questions have come up about how to seat children at tables to eat. And these are valid questions around physical distancing. How is that possible? If I have a classroom of children, what am I going to do? You're going to probably need to advise a provider to bring in more tables into the classroom so that they can do their meals and snacks in the classroom, and to seat children further apart, obviously at mealtime, ideally 6 feet apart. Sometimes programs have chosen to put a chair in between the children and stagger them at the table, which seems to be working well. And also to avoid sitting children directly across from each other during a meal. And this goes for staff and adults as well, to not be sitting directly facing someone, because as we know, the coronavirus is transmitted by droplets that come out of our mouths. And if we're laughing and chewing and talking, sometimes those droplets can really be projected quite a ways into the environment, and we want to avoid that. So when we're taking off our mask to eat, there's more risk for that, right? So trying not to sit right opposite somebody is really important. Let's see, what else does it say here? Also, serving each child individually. Yes, not doing the congregate meal, not doing the family style meal, providing an individual plate of food to a child. A lot of providers have asked that parents bring meals and snacks that are bagged in paper bag products, not the plastic bags, because they're a suffocation hazard. We want to avoid the grocery bags, but they can bring them in the brown paper bags or other paper bags, and then they can be disposed of. Some programs have decided to go with containers that are have the child's label name on them, that can be washed and disinfected, but then they return them home. Again, that's an issue, because if you're moving things back and forth between the setting, the childcare setting, and the home, that is going to increase a risk for transmission of the virus. So we would ask that you avoid that, or that programs could try to avoid bringing things back and forth like that. Physical activity is a great thing, right? For everyone, especially during this time. It'll help kids to blow off a lot of steam. It helps adults also to be outside and in the fresh air. But of course, making sure that everyone is safe when you're doing that is important. So staggering groups to go outside to the playground is important. When they're walking out to the playground, and making sure that they're 6 feet separate from each other, providing more time outside, and then planning activities that limit the close physical contact, sharing of equipment, and waiting in line. So any way that we can avoid those things is best. So I think, Laura, you might have some things to add here.
Yeah, sure. I mean, I think, again, when we think about physical activity and being outside, and it seems like we're really pushing programs to do a lot of outdoor play and to set up some learning centers outside. We just want to always remember that if children are going to be spending some significant time outside, we're going to have to think about hydration stations, and then all the sanitation that goes along with hydration stations, and disposable paper cups, and washing the spigot that children have to push down to get the water. So those are going to be really important. And then we really want to think about shade and how our providers are utilizing shade. Even more important, the longer the children are outside, the more they're going to need access to shade areas, and shade areas that allow them to safely distance themselves from other children. So 2 just important considerations for us to think about.
Thanks, Laura. Okay, so we're going to pivot a little bit now and talk about exclusion from care and work for facilities operating during the pandemic. I'm going to be reviewing the guidance from OCDEL and their latest interim guidance for exclusion from care and work. And I recommend that you print these slides out and definitely go over them in much greater detail on your own time. It's a lot of information to process. It's highly detailed, it's very dense information, and it's a lot of content that I'm going to be going through right now. So if at the end you're feeling overwhelmed with information, that's typical. This is very detailed, and you're going to have to take some time to process it on your own. So exclusion guidance really ties into how we do our health checks in the morning, how we do our screening methods, which, as I said earlier, there are a variety of methods that have been provided by the CDC that will give us some good help with designing procedures and practices around this. But the most important thing is to not allow staff and children to enter the child care facility at all if they have tested positive, obviously, for or showing any symptoms of COVID-19. If we can keep them out of the facility from even coming in the door, we're going to be really much better off, and they're going to be better off because they're going to get the care that they need in a more timely fashion. And so that's really essential. If they've had a recent exposure with a person with COVID-19, we're going to want to screen to make sure that they haven't. And what does that mean? It's more than just asking them, have you been exposed to someone? You really need to ask them what, more specifically, whether they've been in a household or had close contact within 6 feet of an individual with a confirmed or suspected COVID-19 case for at least 15 minutes during the case's infectious period. And persons with COVID-19 are considered infectious from 2 days before onset of symptoms until the end of isolation. And you're probably thinking, well, what about those people who don't have any symptoms? Well, that is a problem, which is why we're making sure that temperatures are taken before people enter into the facility. So, you may not notice that you have symptoms if you're infected. And this has been one of the issues and one of the difficult aspects of COVID-19. So it's really important for everyone who's involved in doing the screening in the morning before staff and children come into the facility that they're very much on top of all of these guidances around exclusion, and that there's clear policies and procedures about who's responsible for doing these procedures. And that should be something that is developed as a policy by the child care operator. And as a person who is going to be supporting them, as a team that's supporting them with these things, it's important that all of these details are addressed. It is very helpful now that OCDEL has provided this interim guidance with very specific steps to follow, because initially in March and April and even in May, we didn't have specific guidance from OCDEL. So OCDEL has really been responsive to what some of the latest guidelines are with regards to confirming cases and to excluding and having people isolated and quarantined and so forth. So this is brand new and it is very helpful. And it dovetails nicely with the licensing regulations, which are the operator shall inform parents of enrolled children when there is a suspected outbreak of a communicable disease. So it's been in the regs for a long time, and the Department of Health has given us this information that an outbreak is defined as a single positive COVID-19 case. So that's all it takes for us to know that we have an issue and that there is a potential outbreak of a communicable disease. With regards to contacting the Department of Health, I have a few points about this. Please note that the Department of Health may not be able to provide additional feedback or support to child care providers. So it is very important that support teams, you all in the audience, understand these directives that we're giving you in this interim guidance. and all the steps that providers need to follow, and that you serve as a resource for a reopening for providers and also for those who are remaining open at this time. So it's important that everyone be very, very well aware of this guidance, because it may not be possible to get more information from the Department of Health. It has varied greatly from one location to another. Again, this is the definition of exposure, which I mentioned earlier, and you can go over it carefully on your own. And during the open space session tomorrow, we will talk about how to implement these practices and how to support programs with the implementation of these practices. So OCDEL has provided the interim guidance with very specific steps to follow if a staff person, household member, or a child is exposed to a person who has tested positive for COVID-19. And these steps must be followed very carefully. And involves informing parents of enrolled children, also informing staff, reporting when staff or child or household member is exposed to a positive case, and also informing childcare staff of a possible exposure to a positive case. So very nuanced here. It's very important to take a look at this carefully and to walk through it and bring your questions tomorrow so that we have an opportunity to go over all your questions and make sure everyone's on board with this guidance. There are some different strategies for discontinuing home isolation, depending upon whether someone's following a symptom-based step or a test-based step. And it can be confusing when you're thinking through this. So this is another reason why we're having our follow-up open session, so that we can have questions answered and people feel free, to talk about possible situations or what if this or what if that, and we'll work through it together. It's not something that just comes completely naturally, I can tell you. There seems to be a different circumstance for every case, and you really need to think it through. So we'll help you with that, and we'll get more familiar with the guidance together. Again, the discontinuation of isolation, very clearly here, there are two different strategies. One is symptom-based, one is test-based, very specific about certain things that have to be met. Someone who has symptoms, for example, who's been told to care for themselves at home, the only way they can discontinue being isolated is if at least 3 days or 72 hours has passed since recovery. In other words, since they haven't had any fever or other symptoms getting worse, such as cough, shortness of breath, or things like that. And then at least 10 days have passed since the symptoms first appeared. So very, very specific guidance here that we need to all be familiar with. Again, you need to review this detailed information carefully on your own and come with questions tomorrow. Testing positive without symptoms. Of course, this was put together because we know a lot of people simply do not have symptoms of being infected, and they may have been tested because they were close to someone within 6 feet, and for 15 minutes they were exposed to someone who had tested positive, who did have symptoms. And so again, another scenario that we need to be thinking about. There's a time-based strategy and a test-based strategy for this type of home isolation, and strategies for discontinuing it. Again, very detailed information that you need to review. Reporting is really important, of course. Again, giving you more clarification on contacting Department of Health right now. The Department of Health may not be able to provide additional feedback or support to providers. So it is very important that participants today on this webinar understand the directives we're providing to you are the steps that providers should follow. So you have the guidance here. You can be empowered now to help providers and operators to follow this guidance, regardless of whether they have additional direction from the Department of Health. The intent of these webinars is to be able to educate all of you to serve as a resource for programs. If they're currently open or if they're thinking about reopening, it's really important that you be fully aware of what these guidances are and that you know how to do the reporting and that you can provide technical assistance and guidance to programs and how to do it properly. We're about finished here, so I wanted to just share some of the additional resources that are available to you when you're providing support. And I would definitely put the DHS provider resource link here into your favorites because it can change quickly. And it's a great place to go and kind of reorient yourself to all of the different things that have come out about the coronavirus from the Department of Human Services and to increase your level of empathy and compassion, I think, for operators who are working currently and trying to sort through all of this information and to stay as up to date with it as possible. So that's a really important resource to have in your favorites as soon as you can. And this is the Department of Economic and Community Development website. Here a link that will help to connect businesses and through an interchange of directory to connect with Pennsylvania businesses that are selling supplies. And I'm assuming this is related to PPE, personal protective equipment, or hand sanitizers, disinfection solutions, things like that. So it's listed right there in the link, PPE and supplies, yes. So it's something to share with programs. I wanted you to know, of course, if you don't know already, that I have been doing multiple webinar recordings since April, I think it was April 27th or 28th. There's 5 of them currently that are posted on the PA Keys website, and they are available for you to listen to. I also have slides there posted with the recordings. A lot of the information that I provide on those webinars goes into additional considerations. So different strategies for different settings, family childcare homes, what do they do as compared to childcare centers? Most recently, I was able to elaborate during the June pre-recorded webinar about different options for doctor's notes, because this seemed to be one of the barriers for programs, thinking that they needed to have a doctor's note in writing and go pick it up, for example, from a doctor's office, or have a parent deliver that to them. Well, that's simply not the case now. We know that it's important to use virtual communication tools now to avoid being in contact with people. So in that webinar, I go into all the different varieties of how doctor's notes can be shared with providers and operators in a way that avoids the contact, the direct contact, and makes it much quicker and more responsive, which we need to have these days because things change so rapidly. So these are posted on the PA Keys coronavirus webpage at the link. Be aware that some of the guidance has been updated since they were recorded, but many of the options I've covered today are the most current. So you're going to be good if you have today's webinar in addition to those pre-recorded webinars on the PA Keys website. And the last one, I also talked about managing summertime activities safely, like going outside, doing sprinklers, water play, safe pool activities, how to stay safe when going to visit places that are outside of the facility, things like that. So I recommend you take a look at that. And also, just in general, the PA Key coronavirus resources, in addition to the webinars that are posted on the PA Keys website, will be really helpful. As you know, if you've registered for this webinar today, you've obviously been to the Childhood Health and Safety Systems Support Resource webpage, which was set up specifically for the groups of health and safety systems and support teams that you all represent. And that has been set up at the PA Keys website there at that link. And every time that we deliver one of these topic areas, for example, next week, we will be talking about family and community partnerships and family engagement and things like that. So we'll be adding more resources as we deliver this content. And throughout this initiative, we'll be adding more to that webpage. So be sure to put that in your favorites also. And be sure to register for our next gathering, which is tomorrow. We're going to be having our open space activity where everyone is going to be able to interact and ask questions. And we'll be going through the PowerPoint again at that time. We'll have the slides up and you can refer us to certain slides that you might have questions about. And of course, the chat box, I'm going to save that today so that we can address your questions that have come in today during the webinar. So we appreciate that. Also, this is the CDC Guidance link, which we have put in our favorites since April 21st. And I recommend you take a look at that and print that out and maybe do some comparisons if you have time between what has been offered by the CDC and what OCDEL has provided. A lot of them mirror each other. A lot of the specifics are the same. But as I said, we're very happy that OCDEL has provided their interim guidance because it's given some very specific guidance around exclusion and what to do when someone has been exposed to the coronavirus. So that's really helpful. Feel free to email your questions anytime. If you're up at 2 o'clock in the morning and you jump up and say, hey, I got a question, send it to us at hssco@pakeys.org, and we will try to address it when we have our next open session. And please remind us if we don't. A lot of questions have come in, hundreds of them already. So we may not get to everything in the first 10 minutes of our open session, but feel free to keep asking those questions as we go on throughout the series of 5 trainings and the series of open sessions. So again, OCDEL is committed to reviewing and addressing all the questions to the best of its ability. And remember that we will be together tomorrow to review this topic during our open session from 2 to 3:30 p.m. So please register if you haven't yet. And tomorrow we'll be able to interact more and talk about implementation and considerations and how to support programs locally with regards to whatever their situation is and whatever their questions might be. So I want to say thank you to everyone who's joined today and for hanging in with me as we went through a lot of detailed information, a lot of content today. And I also want to thank Laura for offering some great considerations and reflections around what this looks like when programs are implementing the guidance in a different setting, whether it be family childcare, home childcare center, or group home. And for different age groups as well, infants, toddlers, preschoolers, school-age kids. And we'll talk more about that tomorrow. But have a really great evening, everyone. And we'll meet again tomorrow from 2 to 3:30. Thank you. Bye-bye.